Hi, CWTS students. This will be our lecture about basic life support.
Basic life support, BLS, an emergency procedure that consists of recognizing respiratory or cardiac arrest or both in the proper application of CPR to maintain life until a victim recovers or advanced life support is available. Advanced cardiac life support, the use of special equipment to maintain breathing and circulation for the victim of cardiac emergency. Prolonged life support, for post-resuscitative and long-term resuscitation. The chain of survival. We have 5 links. First link, early access. It is the event initiated after the patient's collapse until the arrival of emergency medical services personnel prepared to provide care. Second link, early CPR. If started immediately after the victim's collapse, probability of survival approximately doubles when it is initiated before the arrival of EMS. Third link, early defibrillation. It is most likely to improve survival. It is the key intervention to increase the chances of survival of patients without hospital cardiac arrest. Fourth link, early advanced cardiac life support. If provided by highly trained personnel like paramedics, provision of advanced care outside the hospital would be possible. Fifth link, post-cardiac arrest care. Medical personnel to the hospital is in charge for more advanced care and medication needed by the victim. The body regions. Cranial cavity. Includes brain. Thoracic cavity. Includes lungs and heart. Pelvic cavity. Includes bladder, rectum and reproductive organ. Spinal cavity. Includes spinal cord. Abdominal cavity. Includes liver, pancreas, intestine, stomach, kidney and spleen. The body system composed of respiratory, circulatory and the nervous systems. The respiratory system. It delivers oxygen to the body, as well as remove carbon dioxide from the body. The passage of air into and out of the lungs is called respiration. Breathing in is called inspiration or inhaling. Breathing out is called expiration or exhaling. The circulatory system. It delivers oxygen and nutrients to the body's tissue and removes waste products. It consists of the heart, blood vessels, and blood. The nervous system. It is composed of the brain, spinal cord and nerves. It has 2 main functions, communication and control. It led a person to be aware and react to the environment. It coordinates the body's responses to stimuli and keeps body systems working together. Body substance isolation are precautions taken to isolate or prevent risk of exposure from any other type bodily substance. The basic precautions and practices are personal hygiene, protective equipment, cleaning and disinfecting equipment. The cardiovascular disease. Risk factors that cannot be changed or controlled, non-modifiable, heredity, age, gender. Risk factors that can be changed or controlled, modifiable, cigarette smoking, hypertension, elevated cholesterol, triglyceride levels, lack of exercise, obesity, stress, diabetes mellitus. Heart attack or the myocardial infarction. Occurs when the oxygen supply to the heart muscle, myocardium, is cut off for a prolonged period of time. This cutoff results from a reduced blood supply due to severe narrowing or complete blockage of the diseased artery. The result is death, infraction, of the affected part of the heart. The possible causes are thrombus, emboly, atherosclerosis. Guidelines in giving emergency care. 1. Plan of action. 2. Gathering of needed material. 3. Initial response. Remember, aid. A. Ask for help. I. Intervene. D. Do no further harm. 4. Instruction to helper or helpers, direct, specific, concrete. The emergency action principles. 1. Survey the scene. Take time to answer these questions. Is the scene safe? What happened? How many people are injured? Are there bystanders who can help? Identify yourself as a trained first aider, get consent to give care. 2. Activate medical assistance and transfer facility. Depending on the situation, call first and care first. A bystanders should make the telephone call for help, if available. Somebody will be asked to arrange for transfer facility. Information to be remembered in activating medical assistance: what happened? Location? Number of person injured? Extent of injury and first aid given? The telephone number from where you are calling? Person who activated medical assistance must identify him, herself and drop the phone last. 3. Do a primary survey of the victim. Check for consciousness. Check ABC. A. Airway. B. Breathing. C. Circulation. The different ways in opening the airway: head tilt, chin lift maneuver, jaw thrust maneuver. 4. Do a secondary survey of the victim. Interview the victim. S. Signs and symptoms. A. Allergies. M. Medication. P. Post-medical history. L. Last oral intake. E. Events leading to episode. Check vital signs. Critical, every after 5 minutes. Non-critical, every after 15 minutes. Perform head-to-toe examination. D. Deformity. C. Contusion. A. Abrasion. P. Puncture. B. Burn. T. Tenderness. L. Laceration. S. Swelling. The golden rules in giving emergency care. What to do. Do obtain consent when possible. Do think the worst. It is best to administer first aid for the gravest possibility. Do remember to identify yourself to the victim. Do provide comfort and emotional support. Do respect the victim's modesty and physical privacy. Do be as calm and as direct as possible. Do care for the most serious injury first. Do assist the victim with his or her prescription medication. Do keep onlookers away from the injured person. Do handle the victim to a minimum. Do loosen all tied clothing. What not to do. Do not let the victim see his or her own injury. Do not leave the victim alone except to get help. Do not assume that the victim's obvious injuries are the only ones. Do not make unrealistic promises. Do not trust the judgment of a confused victim and require them to make decision. Respiratory arrest is the condition in which breathing stops and circulation continue for quite some time. Causes are: 1. Obstruction. Anatomical obstruction. Mechanical obstruction. 2. Diseases. 3. Other causes. Electrocution. Circulatory collapse. External strangulation. Chest compression. Drowning. Poisoning. Suffocation. Rescue breathing is the technique of breathing air into a person's lung to supply him or her with the oxygen needed to survive. Ways to ventilate the lungs: mouth to mouth, mouth to nose, mouth to mouth and nose, mouth to stoma, mouth to barrier, bag mask device. This is the table of comparison on rescue breathing for adult, child, and infant. The foreign body airway obstruction management. These are the causes of obstruction. 1. Improper chewing or large pieces of foods. 2. Excessive intake of alcohol. 3. The presence of loose upper and lower dentures. 4. For children, running while eating. 5. For smaller children of hand. 2. Mouth stage left unattended. 2 types of obstruction. Anatomical obstruction, when tongue drops back and obstruct the throat. Other causes are acute asthma, croup, diphtheria, swelling, and cough, whooping. Mechanical obstruction, when foreign objects logged in the pharynx or airways, fluids accumulate in the back of the throat. The 2 classification of obstruction are: Mild and severe obstruction. Mild obstruction, victim is responsive and can cough forcefully, although frequently there is wheezing between coughs. Severe obstruction, victim has a weak, ineffective cough, high-pitched noise while inhaling, increased respiratory difficulty, and possibly cyanosis. The victim is unable to speak, breath, or cough and may clutch the neck with thumb and fingers. Movement of air is absent. Cardiac arrest, circulation ceases and vital organs are deprived from oxygen. 3. Condition of cardiac arrest. Cardiovascular collapse, the heart is still beating but its action is so weak that blood is not being circulated through the vascular system to the brain tissue. Ventricular fibrillation occurs when the individual fascicles of the heart beat independently rather than coordinated, synchronized manner that produce rhythmic heartbeat. Cardiac standstill means that the heart stops beating. Cardiopulmonary resuscitation is a combination of chest compression and rescue breathing. This must be combined for effective resuscitation of the victim of cardiac arrest. These are the table of comparison on cardiopulmonary resuscitation for adult, child, and infant. Bandaging guidelines. 1. Skin is not sterile. If a dressing slips over the victim's skin while you are trying to position it, discard and use a fresh one. Place the dressing over the wound, don't slide it into place. 2. Use a dressing that is large enough to extend at least 1 inch beyond the edges of the wound. 3. If body tissue or organs are exposed, cover the wound with a dressing that will not stick, such as plastic wrap or moistened gauze. Then secure the dressing with a bandage or adhesive tape. 4. If the bandage is over the joint, splint and make a bulky dressing so that the joint remains immobilized. If there is no movement of a wound over the joint, there should be improved healing and reduces scarring. 5. A bandage should fit snugly but should not cut off circulation or cause the victim discomfort. If the area beyond the wound changes color, begins to tingle or feel cold, or if the wound starts to swell, the bandage is too tight and should be loosened. 6. Bandaging techniques depend upon 6.1. Size and location of the wound. 6.2. Your first aid skills. 6.3. Materials at hand. The use of triangular bandage. 1. To hold dressing in place. 2. To immobilize or support body part. Emergency transfer, a procedure of moving victim from unsafe place to a safe place. Indication for emergency rescue are 1. Danger of fire or explosion. 2. Danger of toxic gases. 3. Serious traffic hazard. 4. Risk of drowning. 5. Danger of electrocution. 6. Danger of collapsing wall. Selection in the method of transfer depends on the following. 1. Nature and severity of injury. 2. Size of the victim. 3. Physical capability of the first aider. 4. Number of personnel and equipment available. 5. Nature of evacuation route. 6. Distance to be covered. 7. Sex of the victim, last consideration. Pointers to observe during transfer. 1. Victim's airway must be maintained open. 2. Hemorrhage is controlled. 3. Victim is safely maintained in correct position. 4. Regular check of the victim's condition is made. 5. Supporting bandages and dressing remain effectively applied. 6. The method of transfer is safe, comfortable and as speedy as circumstances permit. 7. The victim's body is moved as one unit. 8. The taller first aider stay at the head side of the victim. 9. First aider, bearers must observe ergonomics in lifting and during transfer of victim.
Thank you so much for listening. See you on our future lectures.